Welcome all. And we were talking about how people who have, women who have undergone IVF should take care of themselves. So post-delivery, this is post-delivery. So 6 weeks post-delivery, essentially, I feel these women have to get their blood sugars, their complete blood count, a thyroid test, because most of these individuals have certain metabolic problems during pregnancy. It could be abnormal sugars, abnormal thyroid functions. So they have to get all these tested and also look at their weight as well as blood pressures at the time of 6 weeks post delivery. And if in case, post 6 weeks post delivery, you can also get your lipid profile done. And if in case you are hypertensive and you continue to remain hypertensive, then you should know that maybe this hypertension is not just related to pregnancy, it's much beyond pregnancy. So you may require help to control this blood pressure and constant surveillance, and you may have to take certain medications which is friendly for breastfeeding, and beyond breastfeeding also you may require some kind of surveillance where the blood pressure is controlled. And just like what Aishwarya asked, there can be some autoimmune problems or clotting problems which has actually been detected during pregnancy. So these things have to be kind of found out 6 weeks post delivery, recheck whether these are persisting again. If they are persisting, then they require a little bit of an immunologist advice as well, because they may require immunomodulation for life. They may require anti-clotting medication for life. But there can be several individuals where these autoimmune and clotting problems do not continue beyond pregnancy, but they may have a tendency and they may just have to be vigilant about certain inflammatory stress, which may complicate them later. But otherwise, they have to kind of take care of their metabolic factors, especially the sugars, the thyroids. They should check at least once in 6 months, once in a year. Once in a year, so it's compulsory. If they can do it once in 6 months, that's fine. I think your obstetrician will be able to tell you how frequently they have to repeat a couple of these tests. Because, for instance, if somebody has been hypothyroid during pregnancy, which was newly detected during pregnancy, and they are associated with autoimmune issues, then they have to continue looking at their TSHs once in 3 months, because they might fluctuate. So these kind of specific advices will be given by a doctor 6 weeks post-delivery. And you also have to make sure that you take your iron and calciums, iron at least for 3 months post-delivery, and 6 months you need to take your calcium. You must be told about how to take care of your menstrual health. You must be given contraceptive advice. You must be taught certain exercises which can kind of reverse all the belly fat that you have kind of accumulated during pregnancy. So what I want to tell you, Lakshmi, this is a very important question. Just like how you have been so any person has been so vigilant during pregnancy, post delivery also make sure you get your metabolic factors, that is your sugars, thyroids, basic hemoglobin. And if you were prone to infections, get your cultures done. Get a pap done, pap duo, where you're doing your pap smear as well as your HPV testing. Get yourself vaccinated for cervical cancer, because that is not contraindicated during breastfeeding. Then make sure you lose that extra weight. And then also define your hypertension as well as your blood sugar status, and take advice from your doctor and see what has happened to your autoimmune problem, so that this is all reversed. So I think I've kind of answered your question. We've had some more people
Thank you, ma'am.
join in. Yes, yes. Thanks, Lakshmi. Thanks. Who else has joined, Shrikant? Okay. Yes, Lakshmi. We're waiting for some one or two people to join. So you want to ask anything else before we actually move to the next question from a different person?
Ma'am, one clarification. One of my colleagues said during IVF process after treatment, do we have any side effects, ma'am? Like later, we take
Yeah. See, what you have to understand, Lakshmi, IVF per se does not cause side effects, but yes, you are exposed to certain degree of hormones because you are kind of stimulated and to grow the eggs, then you're given certain hormones because if in case you've had an embryo transfer uh, later, way later than the egg pickup, you may be exposed to certain hormones more than certain individuals who've had a normal pregnancy. But generally, there has not been any statistically increased risk for the kind of exposure that these people have had because of IVF. But what your doctor will definitely take care is what is very important is to identify what are the factors even before you undergo IVF. For instance, I might have an obese lady and she may have abnormal clotting factors. And if she is to be stimulated with hormones, then I should be very careful that she should not probably, have issues which will trigger a clot and, which may be life threatening. And if this lady is already hypertensive or diabetic, there must be good control of all these conditions before we expose her to IVF. See, please understand that IVF treatment in these individuals have been suggested as benefits of undergoing IVF to conceive is much higher than the risk. So this is a statement that we keep saying. There's never a procedure which has zero risks, but you can definitely make sure that the individual who's recruited for this procedure is healthier. So, and they are also under surveillance so that there are no problems either during pregnancy and post delivery. Also, we check for reversibility. So, we just don't let them go, isn't it? We make sure that there are certain pre existing factors which get revealed during pregnancy. It is not going to get worsened only because of hormonal exposure, because if these individuals have made sure that they've had a preconceptional evaluation before IVF, the doctor clearly knows that there are some factors which are existing even before IVF was done. So we will check for reversibility and see which are the ones which are not modified and tell them specifically how to modify these things and make sure that they remain healthy. And I think these are very important questions, Lakshmi. I think I should congratulate both Aishwarya and Lakshmi for asking such cutting edge questions because even in spite of so many years, I think IVF is about 46, 47 years old. There is a taboo to talk about IVF. There's a talk about, if somebody, I still have some couples who come and tell me, doctor, please do not, reveal that it's an IVF pregnancy. We won't do it for confidentiality reasons. But still, there is that mental block in the head that, it is something that should not be undergone by women. And it is something that is going to be life threatening or it's going to cause side effects and all these things. So I think you've asked really very important questions. You've, kind of asked on behalf of all those women who are struggling to ask these kind of questions. And thank you so much for this. And I think we have Vidyashri. Okay. Good morning, Vidyashri. And thank you so much for joining in. Happy Yugadi from our side. So we are kind of hosting this Zoom meeting uh, to celebrate the World Health Day as well as Yugadi. And for me, celebrating any festival is incomplete if I do not talk to my acquaintances and answer women's health related questions. We've had two wonderful people, Aishwarya Jagannathan and Lakshmi, who have asked some very meaningful questions. Lakshmi, can you just briefly tell about yourself so that, I forgot to ask you this question. Just give one line introduction to people before I sign off with you and ask questions to Vidyashri.
Okay, ma'am. Hello, hello everyone. My name is Dr. Lakshmi. Have conceived through IVF only, and Dr. Revati ma'am is the one who has taken me in this beautiful journey. Actually, I was diagnosed with diabetics with many complications. It was very high risky pregnancy, but for me, it was very smooth sail with Dr. Revati ma'am. She had guided me in such a beautiful way that I was fearless. Before, I was very tense of what to be done with so much of complications. But ma'am took me in a very smooth and snail way. So now I've got 5-year-old my baby. Still she's for me a baby only. Her name is Niyati. All his credit goes to Dr. Revati ma'am. Thank you so much, ma'am.
Thank you so much, Lakshmi. And she's a professor of, I think,
Yes.
business
Yeah,
management.
I work in a government college. I'm an assistant professor. Shortly, I'll be getting associate also. I've applied for it. So hoping for the best result.
Thank you so much, Lakshmi. And I
Thank you.
think she asked some very meaningful questions. Now we move on to Vidyashri. Hi, Vidyashri. Vidyashri is with her son, whom I delivered. Yes?
Yes, ma'am. Good
He's
morning,
grown
ma'am.
so old. And thank you so much for joining and happy Yugadi. And we're also celebrating World Health Day. So as part of this, we have reached out to our community, our acquaintances through Mirror Health, and we want you to ask some question, anything that is actually kind of bothering you, so that this could kind of help other women also, on this occasion of World Health Day. Yes, go ahead and ask me anything that you would want on regarding women's health.
Just a second, ma'am. I'll
Yes, please go ahead.
on. How do we manage our regular health checkups and all, ma'am? That I want to know. That's it.
Yes, Vidyashri, that's what I was trying to tell you. See, irrespective whether it is natural conception, IVF conception, doesn't matter. What matters is at what age you delivered your baby, with what risk factors you got pregnant, how was your pregnancy complicated with issues, was it or not? So if it is like that, at 6 weeks, you have to get yourself outlined as by doing some simple tests, because I feel these are things that we can always check, like your complete hemoglobin, look at your HB, look at your total count, look at your platelet count, whether it is all normal, look at your sugar tests, look at that is maybe a HbA1c or maybe a GTT, or you could also do your thyroid tests and see whether it is normal. And if you've had any other additional issues during their pregnancy, because nowadays I find a lot of elderly women getting pregnant, like the clotting issues or the autoimmune problems. Do not just stop monitoring yourself at delivery, okay? Just look at how these tests behave after delivery and get some kind of an advice as to how to monitor these tests, okay, post delivery, so that you will not land up into a bigger problem maybe 10 or 15 years from here. Because we found that a lot of these patients with autoimmune problems, if left unattended, they might develop cardiovascular issues later in life, especially, if you're looking at ANAs, the TPO antibodies, and these kinds of things. So this, and how you can treat them, you can just treat them with as simple, if somebody is positive for TPO, we can give them thyroxine supplementation, look at it very, very closely, make sure that thyroids don't, what should I say, do not become abnormal. And at the same time, like what Aishwarya asked, if somebody is ANA positive, we look at their inflammatory markers, maybe once in 3 months, once in 6 months, look at their CRPs, look at their total count, look at their ESR, see whether they are normal. So all these things can be done. So, and up from that, somebody is hypertensive, you need to be on medications. You also have to reduce your weight, do constant exercises, do routine tests at least once in a year. And nowadays, we do a PAP test along with HPV after delivery, and we are vaccinating every woman. So this is something that you have to take it very seriously, because every 9 minutes, there's a lady who's dying of cervical cancer. So this can be prevented 98% of the times. Nowadays, we are vaccinating girls between 9 and 16 years of age with 2 doses of this vaccine. Similarly, we can actually, kind of vaccinate our delivered women with cervical cancer vaccine up to 45 years of age. So that is actually going to protect you against cervical cancer 98% of the time. So this is something very good and very preventive, and it has no contraindications, can be taken even by breastfeeding women. So all these things, if you take care, I think you should not stop at the level of delivery. Beyond that, you should make it a point to get yourself checked at least once in a year. And, if you have a lump, please voice out in the breast. I'm talking about, do a breast self-examination and check for a lump. And if you think that something is suspicious, please reach out to your doctor. You have YouTube videos as to how to check for lump. Do not check for a lump during the menstrual period. And if you feel something is still suspicious, please meet your doctor. The doctor will tell you whether an ultrasound has to be done, whether a mammography has to be done, so that if picked up early, these life-threatening complications can be averted. So don't take your health for granted. As you're growing older, you need some kind of maintenance. You need servicing. You're so meticulous to put your vehicles for servicing, but you don't really make sure that you go and meet your doctors. So please do not underestimate your health. This is something that I want to, kind of communicate to all those who are present here. Does this answer your question, Vidya?
Yes, ma'am. I got the answer. Thank you.
Thank you so much. So I think we are getting late. For all those who were not able to join, they will probably see the recorded version. And probably if they have any extended questions, they will still reach out to us on phone. And thank you so much for joining in, all of you. And I'm just praying and hoping that this Yugadi is probably going to bring you more luck, more fortune, more positivity. I wouldn't say there's anything called luck, because luck is just a modified version of your hard work. If you put in all the hard work, you get more luck. So get you all the best opportunities, and make you more, what should I say, more responsible and more positive to take care of your health in a very serious way, so that you don't end up into having complications post delivery. And please motivate other women also to do so, because I feel a lot of women don't know about this or are ignorant. They don't really take their life seriously in our country. So please make sure that you give this message to others, so that they also take their health really seriously. And thank you so much. We will stay connected. And I thank the entire team at Mirror Health who've been on the back end. We've had Shrikant, we've had Pramila and Rajgopal, who've actually done all the hard work to try to get you in. And once again, thank Aishwarya, Lakshmi, as well as Vidyashri for making this session very meaningful. So thank you.
Thank you.